Hi, I'm Dr. Mitch Chasen, cosmetic physician here at Reflections, and today we're going to be talking about the forehead, and namely new treatments for the forehead. If you like this video, please remember to give us a thumbs up and subscribe to our channel. And on the right side of the screen, you'll see valuable links to different resources in the field of cosmetic medicine. Thanks for joining us. So lines and wrinkles, especially when they're deep in our forehead, can make us look older or tired or even stressed. When lines were mild, Botox, Dysport, great treatment. Unfortunately, when patients present with deeper lines or wrinkles, Botox and Dysport is not really the treatment anymore. And if we are using it, we're using it in very small quantities. Because what are we doing with these agents? We're actually slowing down the muscles that cause those lines and wrinkles, but those muscles are also responsible for elevating our brows. So if we start using too much of it, things start to fall. Eyebrows become lower, lids become heavier, and that's counterproductive. That's making us look even more sleepy. So a few years ago, we started to use dermal fillers, and dermal fillers are able to create support for the skin. So not only would they improve the lines and wrinkles and contour in this area, they would also elevate the brow and make us look more rested. So today in cosmetic practice, when we evaluate a patient for lines and wrinkles in the forehead, the combination of dermal fillers and agents that gently slow down the muscles are usually the treatment of choice. The key to treating the forehead is early intervention. If we use small amounts of Botox and Dysport early on in life, when the lines are mild, one gets great results and it prevents the signs of aging, namely deeper lines and wrinkles. Once someone presents with deeper lines and wrinkles, the use of too much Botox is a bad thing, and it's something we would rather use some dermal filler and small amounts of Botox or Dysport. It looks pretty easy to take Botox or Dysport and inject it into the forehead, but it takes years of experience to understand who's a good candidate, who's a bad candidate, and what it's going to look like afterwards. Injecting the forehead with dermal filler is a wonderful treatment and something that yields great patient satisfaction, but it is not a treatment for novices. We don't want someone taking a weekend course and then pretending they know how to do that. Dermal filler has to be injected in the right plane, the right depth of tissue, with the right agent, and in the right way. And unfortunately, the risks of doing it improperly are not just bad cosmetic outcomes, they're actually dangerous. So please, if someone is having dermal filler injections, make sure you're seeking care from an experienced physician, someone that's been injecting these agents for years and years. One of the things that makes the treatment of the forehead with dermal fillers more comfortable, safer, and actually something that shouldn't require any downtime are the use of cannulas. Cannulas are not needles. They don't have any points. They're thin, flexible little instruments that we feed under the skin to do the injection. All forehead injections of dermal fillers should use a cannula, and it's something that takes years of experience to master. So when we evaluate a patient that has deep lines in the forehead, we're also looking for signs of loss of volume or fat, because that guides us in how we treat. And like all other areas of the face, we're not just looking at the area we treat, we're looking at the areas next door. Well, we can take a forehead and make it look wonderful, but if the area next to it, namely the temples, are hollow, it just won't look right, it won't look natural. So sometimes we have to treat the area next to the area of concern to achieve the best result. So very often again, the treatment for forehead lines and contour changes is not Botox that just slows the muscle down, but dermal fillers that create support from underneath. So if you're concerned about forehead lines, remember, it is not a one-size-fits-all kind of treatment. We see patients for complimentary consultation and examine a patient. We look at their anatomy. We look at their patterns of repetitive motion and what their mannerism is like. And most importantly, we ask what bugs them. And we come up with a plan of action that's going to make you happy, that's going to make you look more youthful and rested, but still make you look like yourself.